So I'm Dean Fader, I'm a GP by clinical discipline, and I'm a health services researcher, specifically looking at the healthcare response to domestic violence. My goal with my research program around domestic violence and abuse has been to improve the evidence for how healthcare, and specifically doctors and nurses, can respond to their patients experiencing domestic violence and indeed their families. Our research program has covered a number of studies and indeed a number of programs of research. And the one that I think is the most clear-cut achievement is research around training GPs and setting up a referral pathway for general practice into the domestic violence and abuse sector. So remember that the expertise around how to support people who are experiencing domestic violence and abuse actually lies outside the NHS. The key to our intervention that we developed, called IRISi, was to train doctors and nurses in asking and being able to hear disclosures, provide some initial support, but then to offer referral, a kind of warm referral into the domestic violence and abuse sector. It worked. We actually did a cluster randomized trial which showed that made a substantial difference both in identification and referral into the system, improving the health outcomes for those patients and for their families. The support we received from the commercialization team has been invaluable because researchers' competence tends to stop around designing, conducting good research, writing good papers, getting them published in good journals. And our desire was to have the findings, particularly the positive evidence around the effectiveness of the program out in the world. And for that, we had the support of the commercialization team who understood how to move from evidence into the world. And they gave us invaluable support in developing a social enterprise. And that social enterprise became the mechanism for the commissioning of the IRISi program nationally in more than 10% of practices in the UK. And the challenges we faced are largely around convincing the commissioners, not just that this is a cost-effective intervention, which the evidence is very clear about, but that it actually can be integrated into practice and can compete with other priorities like, hip replacements, for instance. Framing that and getting the narrative right, we have benefited from the commercialization team in doing that because it's a different language. The language of commissioning is a different language from the language of research. And we have had to learn that language, and we needed support to do that.